New York is pretty amazing in that sense. Whether people are coming for the arts or they're coming for business, or whatever the reason is that they're coming, they want to be a New Yorker. And I guess I'm fortunate that I am a New Yorker many generations over. The majority of my family comes from Germany, and they were German Jews who left for a better life, like most people do here. The Sephardic side of my family, I don't know other Sephardic Jews particularly, but I certainly know a lot of other German Jews. I do know what makes me really happy is spending time with my family. Always have. I now have 4 grandchildren, and for me, like most people, I'm sure, family is what gives me sustenance. So, I became an activist when I met Ellen Strauss. I've always been interested in helping the plight of women. Bear enormous responsibilities that are quite different from the men because they bear children. And because they bear children, there's health issues involved with that are quite different than face men. And there are economic issues, and there are emotional issues, etc., many of which were never really paid attention to much. Somewhere back in my grandfather, great-grandfather, great-great-grandfather, they got together with other German Jews and helped put a hospital together, which is Mount Sinai Hospital. So there's been a Komen on the board of Mount Sinai since it began. Our father started something called the Komen Institute at Mount Sinai Hospital, which is based on trying to make sure that the patient experience is as good as it can be. And I'm very happy that I'm involved with senior management has decided to take a look at equity and health issues, and have been seriously delving into it. And it's been another interesting road for us to go down. I feel very strongly that I owe society, and in particular New York, because that's where all of my life and my family's life took place. And you add to that women, which I happen to be particularly interested in, and their families. And it makes me happy to be able to be involved. And one of the things that I love about citizens, they get at the very small issues. And I remember my mother telling me, when I meet the man I'm going to marry, or when I'm friends with somebody, or I'm going to live with somebody, it's the little things that are going to kill you. You're going to agree on the big things, but you have to live together on the little things. And that's what we're doing, in my opinion. We're helping those neighborhoods remain good neighbors to each other so they can thrive.
I think the word activist means to me responsibility. To me, activist means you're responsible for your social awareness, you're responsible for your social and political community and what you bring to that community. Beyond the initial grant, my first ever Citizens Committee for New York City gives us access to their vast network of key decision makers, city resources, and community organizing knowledge. Be a New Yorker for New York and donate today.
Good afternoon, and welcome to this month's CitizensNYC Live Rethink and Rebuild discussion. We're so glad that you have joined us today virtually. As we celebrate Women's History Month as a nation, we at Citizens Committee for New York City are also celebrating and honoring 5 extraordinary women who are working to rethink, rebuild, and reimagine New York City, with a new fundraising initiative that we recently launched entitled the New Yorkers for New York campaign. This new innovative take on fundraising during COVID will feature a virtual storytelling series, which focuses on women's rights, entrepreneurship, immigrant heritage, and commitment to diversity. We're aiming to raise $1.5 million this year. And for now, each gift received will be matched 1-to-1 up to $150,000. If you haven't already, be sure to check out our new website for the New Yorkers for New York campaign, where you can learn more about our honorees and donate to help New Yorkers get back on their feet. Just click that QR code that you see on the screen to get full access to our new site, or go to citizensnyc.org/New Yorkers. This month, we're honoring Susan R. Komen as the activist, as you saw in that video. Komen became the co-chair of the Republican Coalition for Choice in 1991 and spent her days on Capitol Hill and across the country as a champion for women's right to choose. Even though she made a detour to Washington, she has been part of the fabric that has made New York City what it is today in so many ways. Susan, whose family established roots in NYC centuries ago, serves as a board member for Citizens Committee for New York City and a current or former board member of several NYC nonprofits, including the New York Women's Foundation, the New York Landmarks Commission, Mount Sinai Health System, and many others. This month, we are proud to honor our longtime supporter and friend, Susan Komen. We have a great panel lined up for you today, but first, let's talk a little bit about money. Right now, we are accepting applications for community leaders for our All-In Neighborhood Grants program. This program provides micro grants of up to $10,000 for neighborhood improvement projects. So applicants are encouraged to apply by March 22nd. So that's next week. All you have to do is just check out that link that you see at the bottom of the screen. And if you apply by March 22nd, you'll be considered for our first round priority deadline. It's also important to note that we at Citizens NYC stand with the Asian American community. Anti-Asian hate crimes and acts of violence of any kind only hurt the human race. So we stand with our brothers and our sisters today. So today, with the lovely panel that we have lined up for you, we'll be discussing the rollout, the vaccine rollout, including attitudes, access, and activism in public health. We'll focus on some of the women leading the way in their communities, in their boroughs, and in their city to demystify public health efforts and engage neighbors in health activism. 70% of our grantee partners at Citizens NYC are women, and we're excited to bring more visibility to the much needed work that women continue to do within the New York City communities. So today we are joined by Dr. Angela Diaz, Director of the Mount Sinai Adolescent Health Center, Dr. Leslie Branch, Racial Policy Scholar and Associate Professor, the Honorable Gail Brewer, Borough President of Manhattan, and Lori Benson, CEO of Hip Hop Public Health. Thank you, ladies, so much for being here with us today. All right, first up, we have Dr. Diaz. Dr. Diaz, thank you for being here. Let's dive in a little bit and talk about the work that you do at Mount Sinai. So how would you describe equity? What does equity mean to you?
Thank you so much. I want to start by actually thanking Susan Komen, because a long-term issue and Henry Cornell, she was the one that connected me to this wonderful organization, the Citizens Committee. And at one point I was honored, and it's just an amazing community. In terms of equity, I want to point out that the social determinants of health disparities, and health equity are relatable. They're actually different things. So the social determinants are the condition in which people live, the type of investment, resources, and opportunities that are available to the community that should help people really be healthy. But unfortunately, many communities do not have enough investments. So often the inadequate investment occurs in communities which already face significant obstacles to maintain good health, and these have a really profound impact on the health and public health of that community. health disparities are the result of these social determinants and lead to really profound differences in the health outcome of the people in the community. And health equity is what we need to do to address these health disparities. And in order to achieve health equity, we really need to dismantle the obstacles, whether it's removing, addressing poverty, discrimination, powerlessness, and the lack of access to good job with fair pay and livable wages, good education, adequate housing, and safe environment, and also access to health care. So equity is really what we do at the Mount Sinai Adolescent Health Center, which is trying to address the negative impact of these investments in certain community on the health of young people.
So who do you serve at Mount Sinai Adolescent Health Center?
At Mount Sinai Adolescent Health Center, we serve young people ages 10 to 26 and their children if they have children. We serve all the young people that show up, regardless of their background, but we cater to young people who are low income and do not have health insurance because we know they do not have the access that they need to the services they desperately need. We serve young people from different life experiences. Some are doing very well. They are healthy. They are going to school. They have loving families. And we also work with young people who, have been abused, have had to exchange sex for food, shelter, anything that they need, necessities. We work with young people who are homeless, immigrants, people who are refugees, asylum seekers, young people who are who are system involved, whether it's foster care, juvenile justice, or criminal justice. So all young people, and the beauty is that they all feel comfortable coming here, whether they are coming for a physical exam to go to college, or they are coming here because they need treatment for some major trauma.
Wow, that's a vulnerable community. How does your team work to address the health disparities that you see?
Yeah, what we do is that we actually, in terms of, I will say, economic situation, we serve the young people. They don't have to have health insurance at all. They don't have to be documented. Whoever comes to us and they are 10 to 26, we serve. And then we don't charge at all. We don't exchange a penny with anyone, especially the people with major need that do not have health insurance. They don't have money. And we want to make sure that they can be treated. And even a kid that may be wealthy, they may need something from us, and we feel that they have a right to be served, to be helped. So we don't exchange money with anyone. We pay for all the services. We pay for all the laboratory tests, most of their medications, and we give them Metro cards to help with their transportation. We want a program without barriers. And we have 34,000 youth at present that we have served and are still within our age range. So they are eligible to continue to come here. And within 12 months, we serve more than 12,000 youth. So we serve a lot of young people from all over New York City. And they come from another 14 counties from New York State, including rural counties, and from other states. As long as they are 10 to 26, they can come and we will serve them. So that was in terms of economy. In terms of race, because we know that in New York City, race and class go together in general. So 94% of our youth are youth of color, mostly Black and brown. And, what we have done is that we have created an environment where they feel comfortable. I mean, you see how many come, thousands and thousands of youth. So they feel comfortable coming. And if you ask them, why do they come to the Mount Sinai Adolescent Health Center? They will say they come because they feel welcome, respected, connected, safe, and not judged. And one of the things that we have done also is that the majority of our staff at all levels of the organization, all levels, are people of color. They represent the youth in terms of race, ethnicity, gender orientation, sexual identity. So we try to have a staff that really reflect the young people so that they see themselves reflected and see possibilities for themselves. The young people love their provider and their clinician regardless of who they are, but we want the young people to see themselves reflected on the staff so that they know they too can do it. They too can have aspiration and go for it.
How long have you been at the center, Dr. Diaz?
Well, I work here since 1984. I came to the center to train. I went to Columbia Medical School, and then I came to Mount Sinai in 1981 to train in pediatrics. And when I was doing pediatrics, someone said, "Oh my God, you seem to really be great with teenagers." And I didn't know. Who knew? So they offered me to stay at Mount Sinai and train in adolescent medicine at the Mount Sinai Adolescent Health Center. That is the program that I am running. And when I finished my training, they offered me a job, and I was very appreciative and very excited. And then shortly after, they asked me to run the clinic. And I think it's such a gift, because when I was a teenager, the very first time that I came to the Mount Sinai Adolescent Health Center was as a teenager. I'm just like the kids that come here, even now. I'm an Afro-Latina, came from extreme poverty, no health insurance, no access to health care at all. I wasn't even immunized against measles, mumps, and rubella as a child.
Wow, yeah.
And then, because I had a challenging life growing up and immigration and back and forth, and they sent me back to do, to do my documentation for being in the United States. So all that sort of came to a point when I was in high school, and I got very, very depressed, and I dropped out of high school. And I came to this clinic. I had the gift of coming to this clinic as a teenager, and they treated me. They gave me mental health. They gave me encouragement, and they helped me get back to high school. And then I was able to, when I finished, to go to college. I went to City College, mostly at night, because I needed to work. And I was a factory worker. And then I got a huge break of going to Columbia Medical School. I got accepted there. And then I just came back.
Wow, that's beautiful. That's amazing. I mean, it's the story of resilience, and we see it in New Yorkers, but we definitely see it in women. And so I'm glad that you shared that. The reason I asked how long you've been there is just because I'm sure that in the work that you do, it's constantly evolving, with so many changes. So, what does the process look like for you as things are constantly evolving, especially with people of color in research? And how do you see support and resources that address health disparities? How do you see that continue to evolve?
What we do is, when you go to medical school, they don't teach you about, our line of work is young people, it's youth. So what we do is that we learn from them. The young people are the experts of their lives. So we take very extensive history and we listen very attentively to what they say. What are they thinking? What are they feeling? What are they doing? And we are very direct with them, very empathic. So we learn the lessons of what is it that they need. And we ask them, what is going to facilitate you coming here to get the services that you need? And what are potential barriers? And then we design the services in partnership with the young people. In a way that they tell us that is what they need. It's not about what we need. I don't know better about, especially, I did pediatrics in 81. I began that. I came to the Adolescent Health Center in 84. Things have changed. But we keep talking with the kids and just really learning and changing. So I will say that we have an organization that is a learning organization and always evolving. And we have evolved a model that I think really works with young people. It's an integrated program where we do physical health, sexual and reproductive health, optical, health education, behavioral and mental health, legal services. We also do educational support. We do mind-body work like yoga, and we do self-expression through the arts, because we think that young people really learn and can express themselves through the arts. So we do dance and photography, and we do much more. And that model is all under one roof, and it's easy. We all work together. We have like 15 different disciplines, and I'm trained medically. So if I see a young person and I find out through my history taking that they can benefit from a mental health person, that same day I connect them to the mental health person. So I sort of overcome the barrier. Oh, they're going to refer me. Mental health. I have to go someplace else. None of that. It's a seamless, warm. Really, we are a team. We work together with you. And we have thousands of young people getting mental health because of the model and the way that we work. And I will say the overall frame that we have is a biopsychosocial, cultural, spiritual approach to adolescence. And we take into account racial, social, and economic justice. It's really a justice-based, strengths-based program where we look at the young people in terms of positive youth development, their strength. People just see, many people see teenagers as problems, and especially Black, and brown teenagers. And we see them in their totality. We don't have patience. We really serve people in that, holistically. So I'm just as interested in the young person being in school and doing well as I'm interested in helping them prevent their pregnancies, for example. So.
Yeah. No, that's amazing. Thank you. Thank you so much for that. We're going to bring you back for the Q&A, but I do want to get the perspective of Dr. Leslie because she has been doing some research along these lines. So we'll continue the conversation, Dr. Diaz. Thank you.
Thank you so much.
Okay, if you're just tuning in, welcome. This month, we're celebrating and honoring 5 extraordinary women who are working to rebuild New York City. We've got the New Yorkers for New York campaign that we've launched about a month ago. It's a virtual fundraising initiative, and our goal is to raise $1.5 million. So if you just click that QR code that just popped up on the screen, it'll take you to citizensnyc.org/New Yorkers, and you can get full access to our brand new site or find ways to donate. Okay, let's bring in Dr. Leslie Branch. Hi, Dr. Branch, how are you?
I'm pretty good. Paige, how are you?
Doing really well. I feel so honored to be speaking to so many doctors today. It is an honor to have you. So we know that you've been studying some attitudes on the vaccine. So can you give us some perspectives? Can you share what you've learned recently on community attitudes around the vaccine and the rollout?
Certainly. And thank you so much for convening this very important talk. And I'm honored to be on a panel with such illustrious sisters. So again, thank you. And in terms of perspective, here's what we learned. So the Bronx Community Foundation and the think tank of the Thinkubator, which is also based in the Bronx, convened or conducted a study in about mid-February around attitudes about the COVID-19 vaccination in New York City. And what we sought in that survey was to better understand New Yorkers' knowledge of the vaccine, where they were getting their information from, if they would get vaccinated, and the reasons for their decisions to take or not take the vaccine. And so the context was to ascertain Bronx residents' attitudes relative to all of New York City attitudes. And what we found is that Bronxites' attitudes around COVID vaccination and concerns mirrored what was being reported in other surveys across New York City as well as our own. And in terms of attitudes, what we found is that 57% of all of New York City who were surveyed in our survey felt that they had enough information to make an informed decision. And we found that 54% of folks surveyed in the Bronx felt that they had enough information to make an informed decision as well. And 58% of all New Yorkers we surveyed said that they were getting their information from the news, And 60% of Bronx folks said that they were getting their information from the news as well. So there was very much a pattern of consistency, if you will, in how Bronxites were responding to our survey as across all of New York City. In terms of concerns that were expressed around the COVID-19 vaccine, 31% in our survey indicated that they were concerned with potential side effects. And in the Bronx, 33% were concerned with side effects, long-term illness, and things like that. In all of our survey, about 6.73% were concerned with the efficacy of the drug, and it was pretty much similar among Bronx residents as well. And so, we were happy to see that folks in the Bronx were actually on par with the survey results of New York City at large. And so here's where it got a little interesting. Although Bronx attitudes and concerns were similar to all of New York City, what was concerning was that 13% fewer Bronxites indicated that they were going to get vaccinated. What was also interesting is that 53% of the folks that we surveyed were women, and 2/3 of those that we surveyed had household incomes below $75,000 a year. What is also interesting is that according to New York City health data by borough, the Bronx has the most confirmed deaths per 100,000 in this COVID outbreak. And so we add to that the lack of care that women face in the medical community around issues taken more seriously by men, right? If a woman has chest pain, it's just indigestion. But if a man has chest pain, we're checking him out for a heart attack stat. And so one factor that folks from marginalized communities like the Bronx they are less likely to take the vaccine is the lack of relationships. And so I really, really liked what Dr. Diaz is doing in her center, is that she hit the nail on the head. It's not just about representation. That matters for sure. People tend to gravitate to people who look like them when they are seeking advice on important issues. But relationship matters too. And unfortunately, in communities of color like the Bronx, what has tended to happen is those relationships have been transactional at best. They've not been transformational. So we just see you as a transaction. We're going to deal with you, and then we're going to send you on your way. And so when we released our survey, I put out a quote that said, while in the instant case of COVID-19, a reactionary response to creating a vaccine is the proper response, right? We definitely need it to. The fact that Black and brown folks and in marginalized communities have just been treated as a transaction is problematic. And so I'm really encouraged by what is happening in Dr. Diaz's shop, because they are forming those all-important relationships, those connections. They are creating a community where people feel validated, affirmed, and safe. And we are able to gain the trust of, people in the community and help them become partners in their own healthcare.
So,
go ahead.
No, so inducting your research, were there any indicators as to how we work together to overcome this, understanding that the mistrust comes from, this idea that the health is transactional, but were there any indicators as to what can be done to make it feel more authentic?
So that's a great question. And one of the things in my role of director of the think tank is not just to sling out policy briefs, but to, talk about some recommendations as well. And in terms of recommendations, it really goes back to what Dr. Diaz said. It's about forming relationships. And one of the things that I like so much about what Citizens Committee does is it listens, right? It doesn't go in as an external stakeholder to a neighborhood and tell a neighborhood, okay, this is what you need to fix your problems. It listens to what the community is saying about why they are experiencing what they are experiencing. And so I really think what needs to happen is people need to listen more. So folks in positions of authority need to listen more. There has been a great risk shift, as talked about by Jacob Hacker in his book, The Great Risk Shift. So those who are least able to, the burden has been shifted to them, but the resources have not accompanied it. And so we're asking people to do stuff and to behave in ways that they are not able to, not because they are irresponsible, but because they don't have the accompanying resources to make it possible.
No, that's great. Thank you, Dr. Branch. That's a great segue because we have the 27th Borough President of Manhattan, Gail Brewer, with us. So Dr. Branch, I'll bring you back on for the Q&A, but this was super helpful. Thank you.
Thank you.
Okay, let's bring in Ms. Brewer. Hello, thank you for being here today. I think you're on mute, Ms. Brewer. Hey. I think, try one more. Yeah, there we go.
You got it?
Yep, we got it.
Go ahead, sorry. So I just want to say it's very daunting to follow those two amazing doctors, and you're a great, certainly a great moderator. And Citizens Committee has been since Oz Elliott, very much a part of my life, and also the work that you do with the Solid Waste Advisory Board, the way you partner. So you understand how to partner. Maybe you could just tell government how to partner, Paige.
So actually, for our listeners, I don't think that they know about your relationship with Oz Elliott. Do you mind just giving us a quick history background on that?
Well, just, he was one of the founders of your wonderful organization. And I can't remember, it was so many years ago, but he certainly took me under his wing. And I don't know, we went to projects together, had dinner. He loves having dinner, lunch, breakfast. And so it was, and I got to know his family, his wife, his daughter. So your organization means a lot to me. You've done so much for New York City.
Oh, thank you. And thanks for being here. So it's interesting, to Dr. Branch's point, it'd be great to learn about how your office is sharing information on testing and the rollout of the vaccine. What have you been experiencing?
It's been a real challenge. So the first, of course, is we got through the worst of the pandemic with food and PPE. And each one of those was its own drama in terms of getting it to the people who need it the most. And so we had a lot of partners because of gazillion volunteers. New York City Housing Authority, tenant leaders, people from the Asian community, mutual aid, amazing people who volunteered. So that was the PPE. All the elected officials, community boards worked on those two. We even had to give PPE, as you know, to the nursing homes, ironically, and to the hospitals, and food to the hospitals. So we got through that. And then we were testing. And the testing, at first it was, again, not in the communities that needed it the most. But the vaccine has been the biggest challenge. So the first, to be honest with you, not a lot of planning. So the first thing that happened was nobody, me included, and I come from the tech community, to figure out how in the world to use the technology, for lack of a better word. And maybe it was a national problem. It gave you heart palpitations to try to figure out how to do it. And of course, if you're a senior alone, there's no way. So we spent really days and days and weeks trying to get this technology to work, in the sense of there were 2 city sites, 1 state site, there were hospital sites, there was a VA site, there was a FEMA site, there was a CDC site, and you had to figure all this out, and of course you can't. But the partnerships worked. So when some of the big sites, like at the Armory or the ones in Brooklyn, Queens, came, or even at churches or at high schools. How did partnership work? This is what worked some weeks ago now, because the time kind of falls together. What worked was giving to an organization in Harlem like Black Health or some of the links groups or the community-based organizations, and saying, okay, at this high school we have, I don't know, we have 500 doses. Each group take 100 and call your individual members and you sign them up. So that's what our, without that, you would have had all the folks, I'm from the Upper West Side, all the Upper West Side folks and all the East Side folks making appointments. Then the next thing we did, we had pop-ups at NYCHA. There were some today, there were some yesterday. I go as often as I can. But you have to, picking up with what both of the doctors stated, you have to go get people to feel that there's a trusted messenger who's telling them that they can come down to the community room and get a shot. And we partnered with Walgreens, we partnered with the fire department, we partnered with the police department, we partnered with Northwell, we partnered with Somos, we partnered with H&H, we partnered with the health department, we partnered with independent pharmacies. And I think people mostly trust their doctor, they mostly trust the local health center, or they mostly trust somebody at the pharmacy, because that's where we go. But then at the same time, we're using all these other spaces. So now here we are, 2021, we're into March, and now we're worried about those who are homebound, of which there could be 400,000 people. And so now we're trying to, with the city assistants, figure out how fire department is taking the lead. Johnson & Johnson helps because it's one shot as opposed to two. But Paige, this has been an amazing rollout, and there have certainly been issues regarding supply, but the planning has been very, very challenging. And so, yes, partnerships are the only way that by May 1st or July 1st, depending on which date you're looking at, we can be successful. As the borough president, my entire staff has been involved with this. We have 2 people full-time getting people appointments.
Wow.
And so, because the seniors, you literally can't do it. Even if you have a cell phone, it's too complicated. And how can you negotiate? Right now, there are about 7 sites. Some of them listed on the mayor's site, of course. Some of them independent. We just, Northwell's great, but they have 2 sites. We have a task force meeting every Tuesday at 3:00. And I remember the last one, somebody said, that's great, Northwell, but are you on the mayor's site so people can find you? Oh, that's a good idea. I think we should do that. So, sometimes, understandably, these hospitals call their patients, which is great. But the public needs to know about it. Otherwise, exactly what happens is that people who need the support the most don't get it. We've also been working with the home health aides. What's most challenging is to have these amazing women go into persons' homes who are disabled or homebound, and they often have not had a vaccine. So the unions, 1199 in particular, has managed to get some special opportunities because they don't have time to wait in line for some of these things. So I'm just saying, there's been so many pieces to put together. Not everybody is Dr. Diaz with this amazing, holistic approach. This has not been a holistic approach. What we have to do is just keep pushing. At this point, it's over 60 underlying conditions. There are many people who can get the shot. I do think that the good news is if you're a driver for somebody who is, home health aide, you can get it. It's almost everybody. And I do think that the technology, God help us that we never have another pandemic like this, but we sure got to get this technology right, because it is not successful. And the other thing we have to get right is plan for it. We knew we were getting this vaccine. And so we didn't even have the list of the nonprofits to partner with to say, these are the senior centers, because don't forget the senior centers are closed. So instead of having the seniors, call Mrs. Jones downstairs, Mrs. Jones had to call them and had to know. Now, luckily, because of all the eating and all of the food issues, Mrs. Jones had not only the seniors on her roster from the center, but also all the other ones that called her. you know, it's been a challenge. I just pray that people understand how important it is. You know, between Johnson and Johnson or the doses that are 2, you need to get a shot, as Dr. Fauci stated. There are still people who are concerned. I unfortunately got a call last night from a nonprofit. This woman, Linda's in the hospital, underlying conditions, on a ventilator, because 3 weeks ago she refused to get a vaccine. So there are people like that who may or may not make it so there's no, to the best of my knowledge, there's no impediment to getting health-wise and getting a shot, but people are still concerned for all the historic reasons that you know. Mm-hmm. But it has been a challenge, I have to say.
Ms. Brewer, we're going to bring you back on for the Q&A, but just for our listeners, you know, we have a network of more than 15,000 grantee partners throughout the city. So for folks who do have the resources to volunteer or who are interested in partnering or figuring out how they can lend a hand, what's the best way for them to go about doing that right now?
Oh, I would do a couple of things. I think the community boards, so there are 12 in Manhattan, 59 in the city. They are, at least in Manhattan, they're very plugged into every center, pop-up, permanent in their area. And they're also very plugged into elected officials. So there are 2 things you could do. If you are a nonprofit where you feel, because your organizations are wonderfully grassroots, right? And if they have, I'm making this up, you know, 30 gardeners, they should all be getting, and maybe they have not been able to get support in terms of a vaccine. They should call the community board, call the elected official, and find a way to be that partner where they make the appointments. There's ways of doing that so that the individual gardener, who could be older, who could have underlying conditions, doesn't have to do it because they get too frustrated. So that's what I would say. You could be the person, the partner, through the city or the state, going through the community board, the elected officials, that does the work of making the appointment.
Okay, great. Thank you. Thank you so much. We'll bring you back for the Q&A, Ms. Brewer. Thank you.
Thank you.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. Yeah. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine.
Hip Hop Doc.
What to do, Dr. Mo?
It's a SOS, we gotta let the folks know.
They believe that the vaccine is bad for you,
but we looked at the data and it just ain't true.
When I got the shot, it kinda felt like the flu.
Shoot, that's much better than the ICU.
The shot's pretty safe, but the Rona is cruel.
It could make you sick, could be the end of you.
It's vaccine or bust, but there's a lot of mistrust.
Cause the system is racist, that's the main basis.
But face it, the numbers don't lie.
We gotta survive and save black and brown lives.
We need community immunity to fight from within.
We need 8 out of 10 to get it in for the win.
To protect and defend and hug your mom again.
Cover your grin, let the healing begin.
Wow, that's awesome. That's so much fun. Welcome, Lori Benson, CEO of Hip Hop Public Health. Thank you for being here. Hi, Lori.
Hi, Paige. Thank you so much for having me and for including Hip Hop Public Health in this incredible panel. I mean, wow, things like this do not happen every day. So thank you so much for including us here.
No, this is great. I think we needed to shake it up a little bit. So that was the perfect song to do it. You know, similar to Dr. Branch, your work is also very research focused. So can you tell us about how you engage community in this type of research that you're doing?
Sure. So actually what you just saw is a little clip of community immunity. And that is our most recent educational campaign, which kind of takes folks on a journey really around vaccine literacy. And that's actually the 5th of 5 videos. So as Borough President Brewer said, you know, there are many reasons why people may not want to take the vaccine, and each video sort of addresses a different component. And the way we create these videos and these educational resources at Hip Hop Public Health really all starts with music. So we harness the transformative power of music, of art and science. We combine it with evidence-based, culturally tailored messaging to really improve health literacy with the goal of health behavior change and ultimately achieving health equity. Now, I work with some incredible folks. We have this transdisciplinary team, similar to how Dr. Diaz talked about the center. We have lots of different folks, from creatives to public health experts and educators and artists. But it all started with Dr. Olajide Williams. We like to call him the hip hop doc. You saw him in that video. He's a neurologist, a professor, a dean at Columbia University Medical Center, and he teamed up with Dougie Fresh, the iconic, legendary rapper, yes, from Harlem, New York City, and probably close to 20 years ago now, and really looked at, well, how can we, string together evidence-based resources, trusted messengers, fact-based science, but package it in a way with music, with movement, with art, in a way so people are more open to the message, but also that the message sticks. Because from what we know, music, it can have such a powerful effect on us, right? It can motivate us, it connects to memories and emotions, but it also cements learning, right? And so why don't we use those things that marketers and advertisers can use so well to kind of get us to buy and do the things maybe we shouldn't do? But if we can harness that for public health, let's do that. And that's exactly why Hip Hop Public Health was born. So I would just say, in addition to supporting folks around vaccine literacy, we have over 140 resources. They're all free. They're all available to everybody. So I hope you all share it. And it's all about physical activity, nutrition, self-care, stroke prevention, and also COVID health behavior. So around vaccine literacy, hand washing, mask wearing. And we even have, I see you put it up on the screen, we have an event this Saturday with Dougie Fresh, Dr. Williams, and colleagues at the New York City Department of Education called Weekend Wellness, where we're actually going to focus on the connections between physical activity and mental health.
That's awesome. That's a really cool history too that you all have. Wait, so you talked a little bit about COVID-19. Mm-hmm. Tell us really quickly, and then we gotta go to the Q&A. Can you tell us really quickly about what you all are doing to demystify COVID-19?
Yeah.
Testing, just getting access to the vaccine.
Sure, Paige, that's such an important point, because there's a lot of mistrust. There's a lot of history of historical medical mistrust, atrocities, particularly with the Black and Brown communities that we serve. And we wanted to make sure to address fears with facts, to have trusted messengers share fact-based messages. So that you have, in that video that you saw Dr. Williams, you also saw Dr. Monique Hedman, you see DMC, who's an iconic musician, and he's so socially conscious and health conscious, caring deeply about communities. So, with this combination of collaborating with folks, Dr. Branch said it's really all about relationships, right? So collaborating with organizations, with institutions, with everybody to get these messages out, and in a way that can really connect with folks very emotionally, and sometimes soften the message through music, and really take people on a journey so that when they are ready to take the vaccine and they are able to, they will actually do it. I think the other thing that we are really eager to partner for anybody out there. All of our resources are available for free. So if you're reaching out to folks, or you'd like to collaborate with Hip Hop Public Health on how to motivate folks within your particular community, we're happy to have those conversations.
Lori, one other question that, I'm a hip hop head myself. So folks that are in the hip hop world, in the hip hop industry, are you finding that they're interested in stepping up to be an ambassador in this way, or are you still seeking folks to get involved? Still asking folks to kind of bridge those gaps for you all? Where is that relationship between you and the industry right now?
That's a great question, Paige. It's a little bit of both. I would say that there are folks within the hip hop world and the entertainment world that are ready now. And there are a lot of folks that are still, taking the information in, and they're kind of going on this journey one step at a time. So, we kind of need to do this all together. Every conversation we have, every presentation we do, there's a few more people that said, I never really thought about it that way. I never really thought about that it's not just about me. It's about my family. It's about my grandma. It's about community immunity. My actions impact everybody else. So figuring out sort of the reasons behind the concern and helping people really think that through is so important. So we really need to, we need to do this together.
That's awesome, Lori. Thank you. It's time to bring all the panelists back on. We've had a lot of good conversations in silos, but let's bring everyone up. I welcome also my colleague, Carla Naomi, who helps run the programs team. So Carla Naomi will be leading the Q&A. Carla, welcome. Hey.
Thanks. Hi. So just want to give a big thank you to our amazing panelists, and you touched upon challenges and successes of the vaccine rollout. So just wanted to hear from you, what are some suggestions that you have for community groups in order for them to engage their neighbors, both young and old, in order to promote better health for our city? So anyone feel free to get started and jump in. Gail, I see you talking, but I think you're on mute.
Okay. Let somebody else go first.
Go ahead, Lori.
I'm happy to jump in. Sometimes, having that conversation starts at home. So being able to say, hey, hey mom, hey grandma, did you see this video? Did you hear this thing at DMC? Have you heard the hip hop doc? So being able to share resources that can kind of meet people where they are and just begin the conversation. And also, I would say, be open to listening. There's a lot of reasons why people may not want to take the vaccine, and there's probably many more if people are open to listening. And so being really willing to have that dialogue and conversation and take people on a journey so that they can hopefully be open to it when it's their time.
And I want to add that it's not about assuming why people don't want to be vaccinated. Yeah. We need to ask the person specifically if they don't want to be vaccinated, why, and try to understand, and then address whatever, as Lori said, really is addressing fear with facts, helping them. And I think also it's helping people understand that getting vaccinated is an act of love, right? Because you want to be near and with your loved ones. And if you're not vaccinated, you're worried about your elderly grandparents or parents, your children depend on you. So it's just very important. And I love what Gail Brewer said, the borough president. She has a strategy, and then she hired people, and then she helped implement things in a way that makes sense for people. This link, making an appointment for link when it takes days to see if an appointment becomes available. It's like the odds of winning the lottery. You need to go and either let people walk in, call them on the phone to make it easy for them, have them call on the phone, and then have people who answer the phone in a timely and friendly way, who speak the language, who understand the community. And also trying to figure out, maybe a person wants to get the vaccine, they just don't know how, or they don't have the transportation or childcare. It's a much more complex issue than people just not wanting to get the vaccine. And people need to have the correct type of education about the vaccine. And I think this hip-hop public health thing is a wonderful way, because it brings the fact in a way that people can relate. And I think music just moves you and help you shift. So I think it's just doing whatever it takes in a way that will connect to different people. And not knowing them.
And to echo the sentiments of my colleagues, I think around this, sometimes maybe we're too much in our head, we're too cerebral, and we need to come at it from the heart, right? People who we are trying to get vaccinated, And it may not be where the folks who are the medical community are in terms of, their I guess the level of education and things like that. So you need to meet people where they are. And telling somebody to do something just because is typically not how it works anymore, especially with today's teenagers, for example. You can't tell them because I said so, because that's not good enough. So really meeting people where they are and addressing what their concerns are, affirming and validating them can go a long way to getting people to do what it is that is good for them.
Yeah, I mean, taking steps towards behavior change, any kind of behavior change, is very emotional, right? I could spend all day with all of you talking about this because this is literally music to our ears, maybe pun intended. But but to have that emotional connection, to really have people feel heard, and as you said before, Dr. Brown, having these transformational interactions as opposed to just transaction, and I guess also, as Dr. Diaz mentioned before, particularly with young people, I would just like to bring this up, if you don't mind, Carla. While young people, even those that are, under the age who can get the vaccine right now, they can be great ambassadors to teaching their families and being great communicators. So even though they may not be the ones who can decide to take the vaccine and it's not their time yet, they can share information with their families, with their communities, and be wonderful ambassadors. So I think that's something that we should think about, and all of our community organizations and leaders around New York City can think about, because young people care deeply about getting back with their friends, seeing their grandmother again, and getting back into school full time. So that's a strategy that could be incredibly impactful.
I would say you have, as Citizens Committee, some of the best grassroots organizations compared to any other group. And so I would do what I said earlier to Paige, which is literally get in touch with them and say, can you be the trusted messenger? Can you be the person that, because literally now, because the numbers of Black and Brown are too low in terms of getting vaccinated compared to the white community. Health centers, federally qualified, H&H are all looking for nonprofits to be that trusted ambassador. So you could then do what Dr. Diaz stated, which is literally say, I'm going to call my, 30 gardeners or my 30 whatevers, and then make those appointments. The technology is an impediment. It's a real impediment. And so even if you want to get it, it's very hard to make that appointment. So just taking that barrier away would give people confidence. And your groups are the trusted messenger. So I think you actually have a wonderful opportunity here to change the trajectory in terms of some of the numbers in the communities where you have these great groups.
Hi, Angela. I think there you go.
When you call those people, like the grassroots people, using the research like what Dr. Branch has, so that you can use the data and understand the community as you design the approaches for them. And I have a research program, and I'm finding that about 30% of our youth who completed the survey, 30% lost a loved one. I mean, the data, and the kids are more anxious, depressed, more interpersonal violence. So if you have that data, you know where to start. So you know where people are, and design the message that will resonate, not just intellectually, but also emotionally, and connect with them and make it easy for them. That link needs to go. It's just too hard to use.
Yeah, definitely agree with you all that it really is just more about the science. It's about access, about equity. So thank you all for addressing all those different aspects. We're out of time, so I'm going to bring back Paige to wrap this up, but thank you again for a great conversation.
Thanks, Carla. Just wondering if there are any final comments, anything that you think folks should know, our community should know, and just New York City, New Yorkers at large.
So I'll hop in there. We are at what is known as an Overton moment. right? And so an Overton moment is a time that happens when things that would have been outside of the realm of consideration for possibilities is now able. It's not considered too radical. This is a radical issue that we're dealing with, and we need to meet it with radical action. And so, part of what I would suggest needs to happen also is from a cultural standpoint. In American culture, we have this thing about it's the individual, it's the individual. There's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. And right now, what we need is to tackle this from together, right? It's not one person that has all the answers. We need to link arms and, get together and do this so we can get back to some semblance of normal. And my hope is that whatever that semblance of normal is, it is not what it was pre-COVID-19, because the socioeconomic determinants of health in Black and Brown communities is not cool.
Yeah, thank you for that.
I think since you have, and I hadn't thought about this before this amazing discussion, but you have a unique set of community-based organizations, because I think the hospitals and the health centers are mostly working with some of the senior groups and groups that are, most readily working in the healthcare field. But you have a whole other group. And I think two questions for them. What is the access point in your neighborhood? Close, because you know what? People are not going to the Javits Center. They're not going to go to Medgar Evers. They're not necessarily going to go to Citi Field. They want to go downstairs. And then the second issue is, can you be the messenger, the trusted messenger? And then you could hook them up with the federally qualified health center or with the hospital or whatever. But it's a very unique, fabulous opportunity, I think, for your groups.
Thank you for that.
For us at Hip Hop Public Health, the videos are nice looking and the music is great and it's fun and educational, but it's all about saving lives. It's all about doing what we can to collaborate and synergize efforts to get the word out, to have the conversations, and to really get people to get the shots in arms so that we can really achieve community immunity. And that's what we like to call it, because it has the word unity in it. Herd immunity is kind of a funny term and feels a little awkward for humans. So community immunity, we are all in this together. And this is really about saving lives and getting to a new normal. As Dr. Branch said, it's not about the normal that was with all of the health disparities and issues that we're facing, that have been uncovered even more, due to the pandemic. It's about what is the new normal and how can we get there together.
And I just want to add that the approach has to be hyper localized, citywide, statewide. Different communities are very different and different things will work. And just as I said before, make it easy. And I just want to make sure that people know that young people age 16 and above who had comorbid conditions, they have asthma and other severe conditions, they are now eligible to be vaccinated. And when the vaccine were created, that age group was tested. So, and now they are doing research in younger children, including infants. So I think moving forward, at some point, the entire population or most of the population will be eligible to be vaccinated.
Oh my goodness. Thank you all for your time and your wisdom. Dr. Branch, Dr. Diaz, Lori, Borough President Brewer, I'm so thankful. We are so thankful. We hope that our partners were able to get some good ideas and really have the courage to jump in. So thank you for being with us today so much.
Thank you for having us.
And as a reminder for folks who are interested in applying for applications, if this sparked an idea for you and you want to help build a community project that could do this type of work, we are now accepting applications for our All in Neighborhood Grants program. All you have to do is check out citizensnyc.org/grantmaking. And we also have a virtual fundraising campaign that is going on right now. For that, you can also go to citizensnyc.org to donate. In case you missed it, today, right now, our CEO, Dr. Rasan Harris, is also hosting a 24-hour room on Clubhouse. It's the new fun thing to do. So show NYC some love if you have some downtime. All you have to do is send us a DM on Twitter, CitizensNYC, or on Instagram, Citizens Committee, and we can send you an invite to Clubhouse so you can get in on the fun. But again, thank you to all of our panelists, and take care out there.